Hi, howdy, welcome back. If you can't tell by the title of today's video, I'm not actually going to be talking about makeup in this one, although I will have some questions for you guys throughout the video. So if you guys want to just shoot out the answers down below, let me know. Or if you actually have questions, let me know. I have no problem answering those. I've had a couple people contact me and ask how my pregnancy is going, because this was a surprise pregnancy. And honestly, it's kind of been a roller coaster, not gonna lie, the last 9 months. I'm currently at 36 weeks and some change, and I have a scheduled C-section in 2.5 weeks. So the baby will be getting delivered roughly around the 39-week area. I know most people say go for 40, but with the issues that I have health-wise and what happened with my last pregnancy, the OB thought it would be better to just schedule the C-section. My last son was so large he could not physically pass through my bone structure. It was not possible. A regular birth was not doable. And she is thinking that this one is going to be the same size, if not a little bit bigger. So that is already scheduled. I'm feeling okay. Like, my breathing has settled out, you know. I still have some issues here and there left over from COVID. Basically what I was told was that my lungs actually endured quite a bit of scarring with all of the bleeding and damage caused by COVID, that about 1/3 of my lungs is now basically scar tissue. So anytime I get anything from what I was told the next year or two, it's pretty much always going to go straight to my lungs. My lungs will continue to heal slowly, but not 100% all at once, like usually happens when you get some kind of chest issue. Apparently, the COVID basically turned parts of my lungs into a slurry mush. And I will probably never quite breathe the same way again. But I'm definitely breathing better than I was. And I've recently had head cold. Cleared up, but it tried to go immediately to my lungs. So my doctors have been very careful on watching that. Everything has been 100% safe for the baby. My diabetes. Diabetes while pregnant is a fight. I'm not gonna lie. Gestational or regular, it does not matter. It is not easy. Mine is fairly well controlled, both while pregnant and not pregnant. If you guys have any questions about diabetes or gestational diabetes, feel free to shoot them down south. Like, just let them down in the comments and I will be happy to answer them. It's not something that bothers me. Just to throw it right off the bat, it is not because of my weight that I am diabetic. Okay, I do know that that has a lot to do with a lot of diabetics, that size and weight can have a lot to do, but when I am not pregnant, I am actually at the appropriate BMI for my height. In my case, it does run in my family. There is a genetic component to it. So when I'm not pregnant, I am listed as what's classified as pre-diabetic. Even though my BMI is where it should be, my pancreas just cannot necessarily keep it where it's supposed to be. While I'm pregnant, I am on multiple injections of insulin in a day. That is why this will be my last baby. It's only my second, I know, but it's gonna be my last, because it does put my body through the ringer, especially with all the insulin and the way I have to watch my diet and stuff like that. Like, it's not that I'm against watching my diet, but it is very difficult to be diabetic and pregnant. It can have negative effects on the baby. So actually during the C-section, I will be getting my tubes tied. If anybody has any questions on how that's done these days, it has changed a little bit in the last couple of years. My doctors walked me through it and I signed off on that. For anybody that doesn't realize, when you're diabetic when pregnant, it can actually have some long-term effects on the baby. In fact, being a gestational diabetic, because technically that's what I'm classified as, because when I'm not pregnant, I'm listed as pre-diabetic, which is not the same as diabetic, technically. Even though I'm still on a lot of the same medications, it is a little different. If your sugar is not well controlled while you're pregnant, your child can end up with underdeveloped lungs that are very weak. It can take years for them to catch up appropriately. So that's one of the reasons I am very careful with my sugar. I am already an asthmatic. And if I can prevent any of my children from having breathing issues, I will. So I am very careful with that. My sugars, I see an endocrinologist every 2 weeks. They go over my sugars, we go over my medication. I have a little bit of a sliding scale that they work me up and down on. I've gone to dietitians. I have gone to the lady I actually see right now. Her specialty is gestational diabetes. So actually she's pretty darn good. The other thing that can happen if you are diabetic while pregnant, and a lot of people don't realize this, is the baby's pancreas will start overproducing insulin to compensate if your sugar's not well controlled. So when the baby is delivered, basically the kid can bottom out. It can cause a lot of problems. It could actually kill them, which is why you always inform the hospital and make sure your doctor, whoever's delivering, is aware that you have sugar issues, because they will immediately take the baby, start checking the sugar very, very regularly, and if needs be, hook it up to a sugar water drip so that it doesn't happen. My first son, when he was born, ended up in the NICU because his pancreas did try to compensate, and they had problems keeping it where it should be for the first day or two. Apparently, by the very fact that I am gestational diabetic during my pregnancy, makes the baby way more inclined to being a diabetic when they become an adult. And with my genetics already, so I'm literally doing everything in my power to make sure that this baby is as healthy as possible. What most people don't realize when it comes to diabetes and pregnancy, that it is not necessarily based on what you eat. Weird, you do have to control your diet. That's 100% clear. But the placenta actually releases a hormone that blocks part of the body's ability to deal with insulin. Because the idea is the more sugar is in the body, the bigger the baby's going to be. It's a natural response the human body has. Those of us who already have a less than great pancreas, it becomes gestational diabetes. A person who has a totally normal pancreas and most likely will never have diabetes will not even show gestational diabetes. The hormone just gets absorbed naturally, I guess you'd say. And their sugar stays where it's supposed to. Not in my case. But the bigger the placenta gets, the more of the hormone it releases, and the harder it becomes to control your sugar, which is literally why I have doctor's appointments every 2 weeks with an endocrinologist to monitor all of this. Anybody have any questions so far? In case you're curious, I have gone to a crap ton of doctors to make sure I stay where I should. This will be my second kid, and I know the example I set now, especially with them, whether they realize it or not, whether my husband realizes it or not, whether the other people in my life realize it or not, will make a lasting impression on my children, my sons, as to how they should care for themselves and their health. So I work my darndest off to keep this where it should be. When I'm not pregnant, you're talking about somebody who spends a lot of time in the gym, exercises, eats pretty well, watches what they eat. Not a big sugar freak like I used to be when I was a lot younger, but the novelty of that wore off in college. So, any questions so far? Okay, if you do have them, feel free to leave them down below. I will answer any that you have. That is also one of the reasons my gestational diabetes is one of the reasons they're doing the C-section. It makes it a lot easier to control the sugar and to monitor the baby. So, there's that. And in case you're curious, yes, my husband is fine with me tying my tubes. We sat down, had a full conversation about it, and it is something we agreed upon. In fact, my husband is getting his own manly tubes tied so that we are not putting the burden of child planning on one person, that it is a decision we're both making. I know, that seems weird. A lot of people have looked at me sideways, but my doctor's office was like, oh, okay. And his doctor's office is like, oh, okay, that makes sense. I'm still debating. Do you guys want to see a video of the baby when it's born? I will give you a sneak peek. It won't be a long one. It'll be like 2 minutes kind of deal. I'll let you know how it goes. I'll let you know if anything goes wrong or anything along those lines. But I have had questions, so I figured, what the heck. Answer any of those questions now. Wish me luck. I'm going to make a couple more videos before I'm scheduled for that C-section, but probably not my normal amount afterwards. I'm probably going to take a week or two off because of the stitches and the large wound along the stomach. If anybody has any questions or concerns or anything, just let me know. I have no problem talking about it. Okay then, I figured I'd keep you up to date. Sorry. Keep you up to date. Let you know what's going on. Because a couple of people have been, asking about how the pregnancy's going. Sorry, I have a tickle. Especially with the COVID and my husband's heart and all that. And in case you're curious, yes, I'm still at work. I intend to work almost up until the day of my delivery. I don't know. But at least it gives me something to do and it helps regulate my sugar a little bit better. So, leave some comments down below. Let me know what you think. And since this is the end of this video, I'm just going to say be safe. The Delta variant is definitely surging in a lot of places. Much to my frustration, I am back to wearing a mask at work. Hence the little bit of acne on my chin. But be safe. Trust me, COVID is not something you want to play with. The Delta variant can be somewhat aggressive. And unlike the original variant of COVID, it can have more significant effects on small children, including neurological. Same with the elderly. It is about 6 times as contagious as the regular COVID virus. So be careful. Wash your hands, social distance, wear a mask where applicable. If you believe in vaccinations, I would suggest getting one. They're having a lot of really good results dealing with the more aggressive strain that is in Africa right now, with the ones that are approved in the US. And it's looking like by the end of this year, all 3 versions will be fully FDA approved on every level. So if you're worried about that, that'll be out of the way. Okay? Be safe.